Hey guys, this is another video for critical care. In our previous video, we discussed about someone who is crashing and that needs to be intubated. We discussed about the rapid sequence intubation, when to do the nasotracheal intubation, and when to do the video laryngoscopy. So we discussed about those things. Today, we're going to discuss the surgical airway, where surgical airway is needed. So when do I need the surgical airway? Let's say I have a patient. I've tried everything for that guy. I've tried the rapid sequence intubation. I've tried the video laryngoscopy, fiber optic intubation. I even tried the nasotracheal intubation. I tried everything. That guy's oxygen is still dropping. Nothing is working. Now, what do I do? Now it's time to cut. So now it's time to cut. So this is when cutting comes into play, where I have to do a surgery for this guy. So we have two options when it comes to surgical airway. One is cryothyrotomy, or you can also call it cricothyrotomy. I will call it cryothyrotomy. I'm not too good with spellings and stuff. And the other one that I can think about is TTGV. It's a very weird name, but very simple. So, Trans-Tracheal Jet Ventilation. So I made it easy. Trans-Tracheal Jet Ventilation. So how can I use these two surgical airways and in what scenarios? So someone again, rapid sequence intubation is not working. Nasotracheal intubation is not working. I'm thinking of surgery. What do I do? I ask myself a couple of questions. Is this guy an adult? So someone who is basically over than 12 in this particular scenario. Someone over than 12, I go for the first option. I go for cryothyrotomy. So a cryothyrotomy is basically what they do is, if you guys can see, this is the hyoid bone. This is the thyroid cartilage, and this is the cricothyroid membrane. And if you guys can see this small soft part, this is where they made the small vertical incision. So they make a small vertical incision over the cryothyroid membrane, which is this one basically. So this membrane here, small vertical incision is made, and then they go in there and intubate the patient. That's the spot. So you can also feel it if you guys cannot find it. The way you can think about it is feel the Adam's apple, that is the thyroid cartilage, and then go down a little until you hit the soft gap before the firm cricoid ring. So that soft part is the cricothyroid membrane. You just make a small surgical incision and give patient oxygenation. What about if someone is less than 12 years old, like a kid? Are you going to be doing the cryothyrotomy? No. For kids, we do TTGV. That is the gold standard. That is the transtracheal ventilation. Why can't we do the cryothyrotomy for kids? That's going to be a question for you guys. Leave an answer in the comments. So in children, cryothyrotomy is very dangerous. That's why we go for TTGV, but I wanted exact answer from you guys in the comments. The way TTGV works is that you take a large bore needle, ideally 16 gauge or 14 gauge, like in this photo here, and then you poke through the cryothyroid membrane, same like what we explained earlier. So you poke through it, and then you hook it up to oxygen source and ventilate under pressure. So poke it through a 16 gauge needle, hook it up to an oxygen source, and then ventilate under pressure. That will do the magic for the kids. So TTGV for kids, cryothyrotomy for adults. Okay, I hope you guys learned something new today. Have a good day.